So the project that I'm gonna be presenting is an evidence-based practice project on how to prevent complications with diabetes mellitus type 2. And this is just talking about the statistics of diabetes. Diabetes affects over 23 million people in the United States. The disease is a problem worldwide. Many of our military veterans have diabetes, and that's very important to me because I come from a military family. I did 4 years in the military. My dad, he's also retired military. A large percentage of the population has not been diagnosed with diabetes mellitus. And here's one of the CDC circle graphs just showing the populations most affected with diabetes mellitus. This is people aged over 20 years old. This is a bit larger, but this green section here, this light green, is non-Hispanic Caucasians, and here are the Asian Americans, and then you have the Hispanics here, non-Hispanics, African Americans, and American Indian. And diabetes mellitus type 2 is when the body doesn't produce enough insulin, or it doesn't make any insulin at all, which causes the person to have hyperglycemia. When a person has high glucose levels, that leads to complications such as stroke, heart disease, neuropathy, peripheral vascular disease, kidney failure, blindness. And these symptoms and complications can be prevented through diet, exercise, medications, and most importantly is the early intervention screening. So you can stop these before they start. Risk factors: physical inactivity, tobacco use, obesity, hypertension, hyperlipidemia, genetics, and also a history of gestational diabetes. Diagnostic testing: AccuChecks, fasting blood sugars, hemoglobin A1C. The hemoglobin A1C shows you that percentage of the glucose concentration for over a 3-month period. That one is the most reliable method for diagnosis. Patients that have a hemoglobin A1C of 5 to 6% is a good normal rate there. Anyone that has 6.5% could possibly be diagnosed with diabetes mellitus because that is elevated. And here's just some of the common symptoms. Y'all are term 4, right? So y'all are familiar with those. Okay. And so the evidence-based practice part. So when you're doing evidence-based practice, you want to start with asking a clinical question that's related to nursing. You want to search for the most relevant research, evidence-based practice articles. You want to check the reliability, credibility of the results and the authors. Are they experts in that area? Are they nurses, doctors? What is their history on the topic? You want to integrate the best practice evidence with patient preferences to make the best decision for change. Evaluate the outcomes, and then you want to disseminate the outcomes of the evidence-based practice decision or change. The PCOT question: this is your clinical question that you're asking to start your research. The PCOT question is based on patient population, problem, intervention, comparison, outcome, and time. So my PCOT question was, in adult patients with diabetes type 2, how does carbohydrate reduction, exercise, and medication compared to not reducing carbohydrates affect hemoglobin A1C within a 3-month period? And here's just a little bit more about evidence-based practice. You want to do research articles. How many people have used the online library with FSCJ? Okay. So they have options on there where you can search for just evidence-based practice articles. I'm not sure. I'll try to pull that up here for you at the end of the presentation. The National Guideline Clearinghouse is a website that has recommendations that have been approved by the Agency of Healthcare Research and Quality of treatment for different diagnoses. So the research showed that a high-protein diet combined with exercise, cardio, and resistant weightlifting proved to be most effective in lowering hemoglobin A1C. Decreased hemoglobin A1C levels reduces the chances of stroke, heart attacks, amputations, and other complications of diabetes. And just here's some of the interventions that were done. The groups that were in the study that I researched about, they had a standard carbohydrate diet with exercise. The second group had a high protein diet with exercise. And then there was also a group that was physically inactive, only a diet only change, which they reduced carbohydrates. And the results showed that the patients with a high protein diet with combined exercise, cardio, as well as weightlifting showed the best results as reducing hemoglobin A1C levels. And some people were able to lower their dosages of hypoglycemic medications if they were taking those, and also hypertension medications. The diet-only group did not show any changes from their baseline. And the people on the carbohydrate diet, some of them did show some minor changes with reduction in their hemoglobin A1C. And their intervention was done for 16 weeks long. So imagine if they continue that process of the exercise and watching what they're eating and compliance with their medication. So as nurses, we just need to make sure that we're reinforcing with our patients, see what all they know about their diabetes mellitus, and if it's someone that does fall into a high-risk category, just talk to them about screening for diabetes. The guidelines recommend that if you're high risk, that you get screened every year for diabetes. And if not, if the person is not high risk, if they're over the age of 45, you tested every 3 years for diabetes mellitus. Because the factor here with diabetes is a lot of people aren't finding out that they have it until they already have the complications. And the study and the guidelines all on preventing complications, they all started with people before they had the complications. So people who were smokers or already had cardiovascular disease or any kidney failure or liver disease, they were excluded from the studies. And this pretty much concludes the end of the presentation. Okay. So if you could please fill out your surveys.
Can we turn this off?
Yes.
Can you stop this thing?